welcome. Today we have Dr. Stephanie Zelembaba here. She's a naturopathic doctor, and I'm so excited she's going to be talking to us about supporting your mood postpartum. So we know that about 23% of new moms in Canada report symptoms consistent with postpartum anxiety and or depression. And so in this webinar, Dr. Stephanie will be discussing everything you need to know about postpartum mood, how to differentiate the baby blues, postpartum depression, and anxiety, and that, typical new mom emotions. So she'll discuss what blood work she recommends in women looking to support their mental health, as well as what treatment options are available. So first off, welcome, Dr. Stephanie. It's so great to have you here with Health Buddha. Please tell us about yourself.
All right. Well, thank you for having me. So I am a naturopathic doctor. I own a clinic with my sister and also naturopathic colleague in Oakville, Ontario. And we primarily focus on what we call family health. So focusing from people planning to get pregnant through the pregnancy and postpartum, and then pediatrics as well. And I also have additional certifications and support in doing doula, as well as childbirth and infant sleep.
Amazing. So that it's great to see that you have all of those certifications, to be able to lean on a naturopathic doctor that also is a doula and that does the hypnobirthing. That's absolutely amazing. Yeah. So love to see that. Okay, so let's get started. Again, we're talking about, supporting your mood postpartum. So what is it that you see when a new patient is coming in? What are those symptoms that they're experiencing, and how can they really differentiate between what's happening to them?
Yeah, fair enough. Yeah. So I find most often in practice, we're seeing a lot more of the postpartum anxiety trend. And that's because we see a lot more postpartum anxiety than we do depression overall. And I find women are more likely to identify with anxiety. So we use anxiety a lot kind of in the world of explaining when we're stressed and that. But what I want to kind of help women realize is the difference between what does it look like when you're a new mom and you're adjusting to this overwhelming new lifestyle versus when is it postpartum anxiety, and additional support could be really helpful. So in those early first 2 weeks, once you've had your baby, we have what's called the baby blues period. And so in that time, we're seeing a lot of really big emotions, massive swings in emotion. So you can go from extremely overjoyed to crying at the drop of a hat. And that's through a combination of quite a few things. So we're getting a very large shift in our hormones during that time. So we go through as large of a shift as we do in menopause over a decade within 2 weeks. And so that can bring with it a lot of different emotions and symptoms. Typically days 3 to 5 are the worst for women in that respect. But any time within those first 2 weeks can be expected. And then when we're differentiating that from what typical postpartum depression anxiety looks like, postpartum depression and anxiety, and when we're seeing a lot more severe or persistent emotions. So not these large swings from happy to sad, but that we're consistently seeing high anxiety or low mood over the course of days to weeks to months. And that's when we're kind of trending into that postpartum anxiety, depression period. And I think what a lot of patients who come into the office don't necessarily realize is that it doesn't have to be the really extreme things that we're seeing in the movies. Now, that can happen. Women can get to the point where they are suicidal or scared they're going to harm their baby, but we're also looking at things like women not really being able to fall asleep at night because they're so anxious about what's going to happen with baby, or they're having fears that aren't necessarily founded in something that is realistic or possible or likely to happen. Or times where women are just feeling like they really can't connect with their baby because they have postpartum depression, and they're seeing all these posts on Instagram about how this is the best time of your life and enjoy every moment. And they are just sitting there going, I don't understand. What are you talking about? And then it makes it even harder on them. And so that's kind of that area where I want women to kind of see that scale that they can fall in anywhere. And still support could be really beneficial.
Yeah, absolutely.
Yeah.
And I think that's really difficult because it is such a huge change in your life. And especially if
Yeah.
you're a new mom, first time mom, and your hormones are changing and there's so much that goes into that. So yeah, it can be really confusing and difficult to understand. Is this normal what I'm feeling? So to have somebody to reach out to and really speak about all of this is amazing. So I think that's great that you offer this. And now also, are there other people that women should be reaching out to, other support workers, or just somebody else that they could also get help with?
Yeah, fair. Yeah. So, what I would say when it comes to reaching out, the first step is reach out anywhere that you feel comfortable, because the biggest barrier for women getting support is reaching out. Often, the majority of women will talk to a friend or a family member first, which is why I always say friends and family members should know about this topic as well. But once that step has been achieved, I would say family doctors, your OB, your midwife, any of those people can start to connect you as well as your naturopathic doctor. And then from there, next steps would be support like counselors, psychotherapists, as well as us for naturopathic doctors to help with the more nutrient and supplement support.
Wonderful. Okay, that's great information. And I think it's going to be super helpful for women who really, don't know who to speak to. So that's amazing. Now, are there different things that we need to think of in terms of things that can affect our mood, whether it be the foods that we're eating or nutrient deficiencies, or different conditions that you often help women think of in terms of support with postpartum?
Yeah, fair. So there's kind of three main areas that we start with as naturopathic doctors, or I do at least, when it comes to supporting. So it's important to look at the prevention piece and the support piece when mood is happening. So blood work is one of the top things I recommend for women, and we're probably not doing comprehensive enough blood work, especially in Ontario. So what I would say is there's three main blood work for nutrients to start with. That would be vitamin B12, your iron, which is usually run by ferritin, and your vitamin D. And so the reason being that all three of those contribute to low energy as well as increased risk of mood concerns. But deficiencies in those vitamins will also aggravate existing mood concerns. So it's kind of doing the prevention and the treatment piece. As an example, a woman is 66% more likely to experience symptoms of postpartum depression or anxiety if they're iron deficient postpartum. And so that's a much greater risk. And when I'm saying iron deficient, I'm saying a ferritin of at least like 30 to 40, whereas a lot of women are not sitting at that level when they're coming out of the postpartum period. So really testing that blood work last trimester and then about 4 to 6 weeks postpartum to see where you're hitting. Another area is your thyroid. So women will often find that they may not have had any thyroid concerns pre-baby, but postpartum tends to be a trigger for thyroid concerns coming up. And so there's two main thyroid markers that I would recommend testing beyond the typical TSH we see. One is something called your anti-TPO, and this is a marker of thyroid autoimmunity. And the reason that we look at that one, as well as the other marker, would be free T4, and that is one of our markers of thyroid functioning. So a high anti-TPO or a low free T4, it's called, will increase your risk of postpartum depression. So both of those values being off, and those aren't typically what we see run standard unless you're having thyroid concerns. So those are two that are worth looking at as well. And your thyroid function should return to normal after baby by about 4 weeks. So if you're looking at that 4 to 6 week postpartum, you should be seeing values that are within range. And then the last piece for blood work wise would be blood sugar. And the reason being that things like insulin resistance, so not necessarily that we're seeing values that are in like a diabetic range that we're typically screening for, but insulin resistance can really affect how our mood is functioning. And when we're seeing that, we're getting a lot of like roller coaster mood and blood sugar values, because if we eat a food, we need to then absorb it into the cell. If we're seeing any insulin resistance, we're getting these spikes of sugar and then these crashes. And women can feel really sucky, for lack of a better term, when we're sitting in those like dips and valleys. And when we're looking at a woman who just had a baby, typically we're not seeing the most consistent eating patterns. So the other piece beyond blood work that I tend to say is really making sure that you're getting some protein, some fruits and vegetable calories in general, especially if you are breastfeeding, because you are giving at least, or you need about an additional 500 calories just to support baby on top of your needs. So sometimes like smoothies, even pre-made ones can be helpful. I even recommend moms have those little like vegetable squishes we give to our kids in their bag, because they're a really easy thing that you can also take to get some veggies and protein for you as well. Yeah.
That's great information. I think that there's so much that women don't realize that really can affect their mood, whether it be those like nutrient deficiencies like you were speaking of, or hypothyroid, blood sugar, all of these things. And it's great to have somebody like yourself there that they can go to and rely on you for this information, because they're already, busy and stressed out in terms of being, new moms. So, being able to have somebody there that can really guide them with this information is amazing. So, is there, now, will you sometimes supplement if they need, like low, if their iron is low or their B12 is low? And if they are supplementing, can they take those supplements with medications that they may be on?
Right. Yes. Yeah. So part of the reason that we do run the blood work is to figure out what supplements are needed. Because I find when patients come in, they'll be like, well, I heard this was like B12 is good for energy, so I'm taking it, but I don't notice the difference. And so part of it is running that blood work so that we know, is that something that you need? So that it's a little bit more targeted. And then the other part is looking at other supplements. So it may not always be about the nutrients. There's a lot of different botanical options, well, and other things, but botanicals are typically where I go for this. So examples like St. John's wort you might have heard of can be a really great option for things like mild to moderate depression, and is safe with breastfeeding and postpartum. There's other botanicals like passion flower, similar, that can be used for anxiety. And so things that I always say that's when I recommend speaking with a healthcare provider, because you want to make sure that that option is right for you and safe for you. And so if you're taking any medications or anything like that for postpartum or for other reasons, we want to make sure that they are not interacting. And so that's where we will make sure to check that something like a St. John's wort, which can have interactions, makes sense in your particular condition.
Absolutely. That's great. And then now thinking preventatively, and I know you spoke about some of the blood work, like obviously if somebody has an iron deficiency already, that's, something that needs to be looked into, and that, you need to think of in terms of, getting support. But is there some things that people can do, really to support their mood preventatively?
Yeah. So one of the biggest things I would say is making sure that you're getting a support system in place, and whatever that looks like for you, depending on how many resources you have available and how many family and friends you have, but that can be one of the biggest ones. The other one is that if you had a really stressful pregnancy or postpartum period, seeking out a counselor or psychotherapist proactively. So some of our biggest risk factors for developing postpartum depression and anxiety are significant stressful events during pregnancy, postpartum, or feeling that you had a really traumatic birth experience. And that's one that I see a ton with women in our practice. So we usually recommend seeking support before it has developed into something. And then the last one is really getting in that regular nutrition. So whatever is possible for you to get in protein and vegetables and fats and fibers, and just as important as you are making sure your baby's hitting those ml calories, make sure you are as well.
That's great information. And I think this is a really important topic, because I don't necessarily feel like people are speaking about it enough, and women are able to express themselves and feel like they can, reach out and get the help that they need. So, so this is wonderful. Thank you so much, Dr. Stephanie. Really appreciate this with you just speaking about this topic, and hopefully, it will get more women to feel more comfortable with speaking to others and getting the support that they need. So thank you so much for coming out today.